Professor. I am Harmanpreet. This is my video for Neuro and Musculoskeletal System Assessment. I am showing you the 360-degree view of my room. Okay. Hello, Ms. Ishika. My name is Harmanpreet Kaur. I am your nurse for today. So, doctor has asked me to assess your neuro and musculoskeletal system. So, are you okay with that?
Yeah.
Okay. So, I have performed the hand hygiene. I have checked for contact precautions. I have maintained the privacy. So, before we begin, Ms. Ishika, can you please tell me your full name?
Ishika Sharma,
Okay, and date of birth?
10 June 2002.
Perfect. Now I will ask you some questions to assess your neuro and musculoskeletal system. Now for your neurological system, can you tell me, do you have headache,
No.
seizures,
No.
and any history of fall?
No.
Okay, for musculoskeletal system, can you tell me you have joint pains?
No.
And are you using any assistive devices?
No.
And any history of arthritis?
No.
Okay, now I will assess your level of consciousness, alertness. Can you tell me who is the President of United States?
Yeah, Donald Trump.
Okay, and what country is this?
Canada.
And what state?
Ontario.
Okay, and can you tell me the time?
Yeah, it's 2 p.m.
Okay, so patient is perfectly oriented to person, place and time, and upon assessment of your behavior, I can see that you act appropriately and you are very well groomed, you have maintained your hygiene and there is no slurred speech, your mood is good, and I can see that there is no flat face, you're smiling and giving expressions, which is good. Okay, so Miss Ishika, now can you please just stand up and walk a little? I need to assess your gait and posture. Okay, your sit down, your gait is steady, your posture is upright and balance is good, which is good. Now I will assess your 3 cranial nerves. So firstly, I will assess your cranial nerve third, which is oculomotor, and for that I can see upon inspection there is no drooping of eyelids. Now to check your perla, I'm using this flashlight. Okay, so I can see that your pupils are equally round and reactive to light and accommodation, and they are converging. Now I need to check the diameter of your pupil. I'm using the scale. Okay, so the diameter is 4 mm, which is appropriate. Now I want you to follow the tip of this pencil. This is just to check your pupil. Okay, so your pupil is dilating and constricting, which is equally bilateral. Moving forward, now I will assess the next cranial nerve, which is cranial nerve fifth, the trigeminal nerve. And for that, I want you to clench your teeth. Okay, now I will apply some resistance under your jaw and you need to open the mouth. Okay, perfect. Now, Ms. Ishika, I will place this pencil on your face. You just need to tell me where it is. Okay, close your eyes.
Cheeks.
Okay.
Forehead.
Perfect. Now for the assessment of your last cranial nerve, the facial nerve, can you raise your eyebrows? Okay. Can you frown? Can you puff your cheeks? Okay. And can you smile for me? Perfect. Keep smiling. Now that is done. So Ms. Ishika, now I want you to please stand up because I need to check your spine. Okay. Upon inspection and palpitation of your spine, I can see there is no kyphosis, lordosis or scoliosis. You can sit down. I need to assess your gross motor skill, and for that I want you to do hyper extension of your neck like this. Okay, and can you do plantar flexion of your toes, dorsiflexion of toes? Okay, now can you do supination of hands, wrist, pronation? Perfect. And you need to stand. I need to assess your hips as well. So can you do abduction and adduction? Abduction, adduction. Okay, perfect. You can sit down. So, Ms. Ishika, moving forward, I need to assess the muscle strength of your upper and lower extremities. Now, I'm giving you my fingers. I want you to press them with as strength as you can. Okay. So, upon assessment, the muscle strength of your upper extremities is +5, which is bilaterally equal. Now for your lower extremities, I am putting some resistance on your feet. You need to push up. Okay, so upon resistance, the muscle strength is +5, which is bilaterally equal. All right, Ms. Ishika, last but not the least, can you tell me, do you have any sensation of numbness or tingling in upper body or lower body? Okay, that's it, Ms. Ishika. We are done. Thank you so much for cooperation.
Thank you.
Thank you, Professor Stephanie. This is the 360-degree view of my room.